A mass on the kidney, symptoms and treatment. Kidney or renal masses or tumors are growths that develop on the kidney. They can be cancerous or benign. In some cases, they may indicate an infection. Healthcare professionals can diagnose a mass on the kidney using imaging tests such as ultrasound, MRI or CT scans. The treatment will vary depending on the type of growth. One type of mass that healthcare professionals can find on the kidney is renal cell carcinoma, which is a type of cancer. Early diagnosis of renal cell carcinoma usually results in a better outlook. Keep watching to learn more about finding a mass on the kidney and how doctors treat these tumors. What is a kidney mass? A mass or tumor on the kidney refers to an abnormal growth on this organ. Most growths that develop in the kidney are not cancerous. However, they might still require medical intervention. Healthcare professionals will describe kidney masses as solid or cystic. Solid masses comprise tissue, whereas cystic masses contain air, fluid, pus, or other material. There are various types of kidney masses, and their causes, symptoms, and treatments will differ. For example, a cyst on the kidney most commonly indicates a simple fluid-filled cyst. It does not usually require any medical interventions unless it grows too large or becomes infected. Does the size of the mass matter? Healthcare professionals will consider various factors including the size of the tumor to help them determine whether it is a cause for concern. They may use different imaging techniques to determine the size of the mass. Generally, research shows that tumors less than 3 to 4 centimeters across are less likely to be malignant or cancerous. Up to 40% of 2 centimeter kidney masses are benign or non-cancerous, with only 10% being high-grade renal cell carcinoma. Nearly 30% of masses that are 4 centimeter or larger are high-grade cancer. Healthcare professionals may perform additional tests on people with larger kidney masses as they carry a higher chance of being malignant. Kidney cancer. The main concern of solid kidney masses is renal cell carcinoma, which is the most common form of kidney cancer. Approximately 9 out of 10 people with kidney cancer have renal cell carcinoma. Other cancers of the kidney include clear cell renal cell carcinoma, non-clear cell renal cell carcinoma, transitional cell carcinoma, nephroblastoma, renal sarcoma. Some benign tumors of the kidneys are angiomyolipoma, oncocytoma, metanephric adenoma. Staging kidney cancer. After confirming a diagnosis of kidney cancer, doctors will determine the cancer's staging. Staging allows doctors to identify how far the cancer has spread. According to the TNM system, stage 1 is the least serious form of cancer, while stage 4 describes advanced cancer. The TNM system involves checking the following: tumor size. Doctors will determine the size and extent of the primary tumor. Nodes. They will check whether the tumor has spread to nearby lymph nodes. Metastasis. Imaging tests can reveal whether the tumor has spread to other parts of the body, such as the bones or lungs. Causes of renal masses. A mass on the kidney may occur for different reasons. For kidney carcinoma, a type of cancer, smoking is a major cause. Other causes of kidney carcinoma include benzene, herbicides, vinol. Some medications including non-steroidal anti-inflammatory drugs, although further research is necessary to confirm this. Some genes may also contribute to kidney mass formation. Polycystic kidney disease is a medical condition that results from gene mutations. People living with polycystic kidney disease develop many cystic masses on their kidneys. Von Hippel-Lindau syndrome is another rare disease that can cause growths in the kidneys. People living with von Hippel-Lindau syndrome have many cysts and tumors in different body organs such as the kidneys. Birt-Hogg-Dubh syndrome is another genetic disorder that causes kidney tumors, among other symptoms. Signs and symptoms of renal masses. A mass on the kidney rarely causes symptoms initially. However, in the advanced stages, symptoms may develop. People may have pain between the ribs and the hip and notice blood in the urine. Sometimes healthcare professionals can feel the tumor when carrying out a physical examination. Some signs and symptoms that may indicate a mass on the kidney include a new diagnosis of high blood pressure, high calcium levels in the blood, unintentional weight loss, night sweats, atypical red blood cell count. Symptoms are not a reliable way to diagnose kidney masses. If people experience any of these symptoms or notice these changes, they should consult a healthcare professional. Treatment for renal masses. The treatment for kidney masses depends on the diagnosis. For masses due to infections, a doctor may prescribe antibiotics. For kidney cancer, the treatment options can depend on the person's age and overall health, the size and shape of the tumor, the person's preferences, previous treatments. Biopsies, surgery and thermal ablation are possible treatments for kidney cancer. With thermal ablation, doctors use heat to destroy the tumor. Complications can sometimes occur from the treatment of kidney masses. This may include infections, bleeding, kidney failure. Sometimes, rather than treating smaller masses, typically those smaller than 3 cm, healthcare professionals will perform frequent checkups using imaging tests. This is called active surveillance. Its main aim is to prevent the tumor from causing problems for the person. Some experts agree that checking the mass through medical imaging every 3 to 6 months for the first year is appropriate. Once the healthcare professional has determined how the mass is changing over time, they may adjust the time between checkups. According to the experts, the incidence of kidney masses has increased over the past few decades. However, it is likely that improved imaging techniques can better detect abnormal growths, resulting in more diagnosis. The outlook for people with incidentally small renal masses is good. The 5-year survival rate has improved steadily in recent years because of new treatments and earlier detection. Experts estimate that the survival rate for stage 1 and 2 renal cell carcinoma is greater than 90%. However, in the advanced stages of renal cell carcinoma, this falls below 15%.